I call the meeting of the Board of Health of December 13th, 2021 to order. The first item on the agenda under new business for discussion is the facial covering requirements in public indoor enclosed locations. Do we have anyone in the audience that wishes to speak on the motion? Okay. If you could approach the podium and state your name and address for the record, that would be helpful.
My name is Jacqueline Pelletier. I'm here from 45 Palmer Street. I own a small business with my husband. I oppose a citywide mask mandate because I feel that masking is a personal choice. Mandates were a short-term solution, and it's time to shift the strategy so we can maintain a growing, sustainable economy. COVID still spreads among students who are masked all day in school. It is wrong to mandate what should be done in your place of worship. That point should be removed from your mandate, whether you pass it today or not. Government does not belong in church. Masks are littering our streets, parks, and sewer drainage. I would like to know, how quickly does the board predict cases will come down in Lowell after a mask mandate is in place? What number of cases is the benchmark for removing the mandate if you put one in place? Why can fitness center employees and patrons, according to your draft, remove the mask when they are 6 feet apart, but other industries cannot? Is there concern that the 20% of Lowell residents who live in poverty and their children do not have access to clean sanitary masks on a daily basis? Thank you for your time and consideration before voting on something that directly impacts the entire community.
Thank you. Is there anyone else?
Scott Pelletier, 45 Palmer. I also have some studies for you that I'll just leave right here. I couldn't find your email on the website, so I brought those for you. I would have emailed them earlier. I've come before you tonight to express my concerns regarding a potential mask mandate. 2 weeks to flatten the curve has turned into 2 years of failed mandates and measures. Follow the science has become a catchphrase. So let's do that. I feel that if you're going to require people to do something, you have an obligation to prove that the measures work. I've not been able to find any control studies that show masks work. But I have been able to find 47 studies that I just gave you that show that masks are ineffective. I also have 32 studies that I just gave you that show masking side effects and their health implications. Also, if masks work so well, how do you explain away Florida? The third largest state in the union, 20 million people, no masks, no mandates, and they have the lowest per capita case rate in the country as of today. Many doctors have said the number one driver of COVID surge is seasonality and the lack of vitamin D. There are many studies done on this from PubMed, and I can give you the number for that, to a Mayo Clinic study, and lastly, a recent one from the University of Chicago that showed 80% of positive COVID patients were vitamin D deficient. I think it's time to try something new. I say we throw away the masks, stop wasting money on them, stop filling the rivers, oceans, and landfills with them, keep them off our sidewalks. Let's use the resources to give out vitamin D to the community. Let's educate the community. And lastly, who's going to enforce the mandate if you do put it in? We as an establishment try very hard to give our employees a safe environment to work in. There have been multiple cases of violence regarding enforcing this. In New York City, most specifically to my situation, a host in New York City was assaulted and beaten and taken to the hospital. A family dining in a restaurant could not wear masks because of medical conditions, and they were harassed and thrown out of the restaurant by the people that were by the other customers that were there. I, for one, certainly don't want to put my employees in any such situations where they have to enforce things that I don't feel it's their job to enforce. And if they do, who's the liability come to? You, the city, who's putting in the mandate? So do we hold you liable? Thank you very much for your time, and happy holidays.
Thank you. If people that speak could sign the register to speak list, that would be helpful. Is there someone else that would like to speak? I just want to mention that we have one board member who has called in and is on the phone. So Erin is present on the phone, just for the record.
Hi, my name is Craig Faulkner. I'm from 197 Market Street, Warp and Weft. I would just like to suggest that you try and come up with another alternative. What I know is that my business increased 60% once these mandates were ended. So I have to assume that by these new mandates, my business will decrease back another 60%. For Warp and Weft. And that will force us to just shut down until this is over. We don't have enough money in the bank we're in the middle of or at the end of a pandemic, wherever we are in this pandemic. I mean, this is going to go on forever. There are going to be new strains. I'm fully vaccinated and boosted. So this is not about, me denying science or not, or anything that anyone else has to say. This is simply for me a business choice that the masks, if you tell me that people have to wear a mask until they sit down and start eating, COVID is not walking by that table saying, well, they're in the middle of dinner, we're not going to infect them. That is the same to me as suggesting that if you go into a supermarket, you have to wear a mask except in the even-numbered aisles. It just doesn't make sense. So I would like to suggest that we come up with an alternative that actually will be effective, and I don't believe this will be that. Thank you.
Thank you. Is there anyone else that wishes to speak?
Hi.
Hi, if you
Hi.
could state your name and sign the list.
Sure.
there. Thank-
My name is Sarah Quigley. I live on Edson Street in Lowell. I also own a business called The Social Pup. So my perspective is slightly different because we deal primarily in dogs. So we have been lucky that we haven't had a problem. The few times that we've had staff test positive with masks and without masks, none of our staff have spread it to anybody else. I work in the veterinary field too, so we're very familiar with coronaviruses and how they work. We're very familiar with wearing masks in terms of veterinary medicine. I do not think that this is going to help in terms of the fear that people feel. This is going to just make it worse. I can't speak to whether or not masks actually help in general. I just know that people don't wear masks correctly. People also pull them down, touch their mouth, touch something, touch their mouth. So this is just to make us feel a little better about the fact that we cannot control the environment around us. And I think that we need to just step back a little and understand that this isn't going to be controllable, that this is going to be a long-term thing. And if we're going to have to wear masks, we're going to have to wear them long-term. So it's going to affect our businesses long-term if we continue to wear masks. I personally feel like we shouldn't have to. It should be a choice between the business, if the business feels that their staff is unsafe, or that customers can't be properly sanitized or whatever. And it should be a personal choice as well. If I'm going to go into a supermarket, I may possibly wear a mask. If I'm going to go into Warp and Weft, I feel safe enough that I can sit down because I'm going to take off my mask anyways to eat. So me walking by someone is not going to make a difference. As soon as I sit at that table, I'm taking off the mask and taking a drink. So I just think that we need to come up with something better because I think all we're going to do is scare the general public into saying, okay, we need to put this back on, and people are not going to know what to come and go. And then my other point is how is that going to be enforced if we do go through this? I can't ask my staff to enforce this in my building. Now, I have a different issue. I have a different thing where people are only coming in and out. They're not staying. They're picking up dogs and cats. They're leaving. But if I have a client that's upset about it, which I've had, I can't do anything about that. When we had the mask mandate and we told people we were doing curbside, we still had people banging on our door trying to force their way in. So that is my fear for them, is I don't want to see them get yelled at, myself get yelled at. Local businesses have issues with that because we don't have any recourse to that. What are we going to do? Call the police? Like, it's just not fair to ask us to enforce that. So that's really what I have to say. And thank you for hearing me out.
Thank you. Is there anyone else that wishes to speak?
Sorry. His pen's not working. Need a new pen. Yeah. Need a new pen. I'll get one. I have one.
Hello, my name is Megan Hara, and I own Eiffel Beauty on Middle Street, 33 Middle Street. Since we have made masks optional, it has increased our business. We are definitely sanitizing between every single client. We've found that masks are definitely not stopping people from coming in. So we don't want to scare them by bringing the masks back. We definitely have been extra cautious since we've removed masks because of that reason. We're in their face, we are cutting their hair. And because of all the extra precautions that we have taken, I'm pretty proud of the fact that we have not had any issues with any of our clientele. And I think that we've created a completely safe environment for everyone so that we can continue to not wear masks. And I just hope that we can find a different way of doing this. And I too would like to know how this would be enforced. Thank you.
Thank you.
Good evening, Tim Kelleher, one of the owners of the Smokehouse at 98 Middle Street. We are a nightclub. We were the last ones to open when this ended, and I would like the board to really look into finding another solution to this. A few concerns are that it's not going to slow down if the kids and the people can just go to New Hampshire and come right back and raise the numbers up in Lowell. I checked with Boston, and they have a mask mandate, and their numbers have doubled since the mask mandate. And then I'm also concerned about losing employees to New Hampshire. If they can go there and they don't have to wear a mask the entire time, their night is more enjoyable. And I think there should be another solution, and I would like you folks to try and find one. Thank you.
Thank you. Is there anyone else that wishes to speak? Okay, thank you for your input. I'll now open it up to, oh, I'm sorry.
Hi, my name's Andy Jacobson. I have a small business, Brewed Awakening Coffee House on Market Street. I just want to sort of kind of reiterate a little bit of what my other fellow business folks have talked about. I mean, I think at the very beginning of this, back in 2020, I think it was made sense to have masks in place. You know, keeping out of the politics out of it. But I think at this point, in the game where there is more vaccination rates. I think, like everyone said, we need a new strategy. Masks are not the answer. It's been since March, April, since we've not had to have masks, and I think it's going to make it a lot harder for us businesses to try to enforce it. And like everyone else, I can't put my employees at risk if someone's coming in and arguing with us, well, yesterday they weren't able to wear a mask, but now they have to. It really doesn't make sense to me. I think we need to, I like the fact that the city has been following the state guidelines, and now we're sort of changing that. And, like he was just saying, Boston's seeing an increase, kids are seeing an increase, and they've all been wearing masks. So a new strategy has to be looked at. If it's regarding vaccinations, are we looking at the communities within the city that aren't getting vaccinated? My plan was, I would be quite honest, we got lots of money from this, the COVID rescue plan. Go to their house with Johnson & Johnson jabs and be like, listen, it's the holidays. I'll give you $500 if you want to get jabbed right now, if this is going to solve it. Sometimes money is going to speak louder than, any other feelings or not, but then there's going to be some that just don't want it, and that's fine. That's their personal reason, and, for medical or for whatever. But I think we need to look at a new strategy. I don't think this is going to be the answer. It's not going to solve anything, especially since you're only going to have it, until February. Everybody else is then you're going to remove it, and then new variant's going to come, and we're just going to put it right back on again. This back and forth seesawing ain't going to work. And like he said, people can just go up to Nashua, Pelham, wherever, and go get drinks, go get food. And, downtown Lowell already struggles. We don't need more obstacles in place. Thank you.
Thank you. Is there anyone else that wishes to speak? Sure.
I just want to add that Governor Baker came out today and said that there was no need to put a mask mandate in Massachusetts currently. Okay.
Thank you. Okay, so I would just like to make a few comments, and then I'll open it up to other board members for their input. So just a little background about what brought this mask mandate to the board's attention is that the public health authorities are recommending that we use every mitigation measure that we can right now, because unfortunately the case rate in Lowell is now at 76. So just for comparison, people brought up Boston and Worcester. They have mask mandates. The infection rate in Lowell is now at 9.8. The Boston infection rate is 1.9. The Worcester infection rate is 2.7. Unfortunately, it's difficult to compare those other communities to Lowell because we have such a high infection rate and a high case rate right now. And so the increasing case rates, the increasing infectivity rate in this city, which is unfortunately much higher than any other city, and the reduced hospital capacity, which maybe Dr. Galvin can speak to a little bit closer, is the second reason to look at mask mandates, and the second reason to institute whatever mitigation measures that you feel do work, that do offer some help. And the third reason is the insufficient vaccination rates. And so the gentleman spoke about vaccination rates, and we should be getting as many people vaccinated as we can. So the health department has spent this whole year trying to get people vaccinated and done things like given $25 if you get your vaccination, mobile vaccine clinics in neighborhoods, in schools, and had mass vaccination sites in the city. We think we've done everything we can to try to convince people who are unvaccinated to get vaccinated, but it's a daily thing at the health department. The nurses at the health department have pretty much spent every single day in the last year trying to convince people to get vaccinated and to let the people of Lowell know where they can get vaccinated. So I totally support what you said about vaccination. The only real way out of this is to improve our vaccination rates. And, you know, it's difficult for the healthcare workers, like Dr. Galvin and his staff at Lowell General, to continue to watch a younger population of people getting very sick and dying from COVID. The older population in the city has a very high vaccination rate. We started vaccinations at the senior center, and the vaccination rate among the elderly in the city is excellent. So what we're seeing now is, for the most part, the majority of folks in the hospital are unvaccinated that are getting sick. And so the public health authorities are saying, given the case rate in Lowell, and given your infectivity rate, and given your reduced hospital capacity, you should be instituting every measure you possibly can that science has shown is effective. And so we will continue to try to convince everyone to get vaccinated. But I also feel that, and I don't speak for the whole board, that we should try this. We should institute this and see where the numbers go. And the reason it's only until February is because we should be taking a look at those numbers monthly. In terms of enforcement, there was a lot of questions around enforcement. We don't expect your employees to enforce the mask mandate. We have Sean Machado here, who is our chief health inspector. And just like the last time there was a mask mandate from the governor's office, the health inspectors will be charged with enforcing the mask mandate. And I think the governor is right. There's lots of cities and towns in this Commonwealth that don't need a mask mandate. And so I think when the governor says we're not doing a statewide mask mandate, he's right. There's communities in this state that have 80% vaccination rate in their schools, and their children don't have to wear masks. God, do we wish we were one of those communities, but we're not. And so that's where this is coming from in terms of a perspective of this is Lowell, a fabulous city, but we have to look at the numbers. And we are doing everything we can to get people vaccinated, but unfortunately, our infectivity rate and our case rate is just not good right now. And it's being suggested to us by the public health physicians that we should do whatever we can, every mitigation measure we can come up with because of our skyrocketing numbers. You know, there's only 65% of the population in Lowell is fully vaccinated. And so public health is always about a balancing act between personal choices. Someone mentioned personal choices, that people should have the personal choice not to wear a mask. It's always a balancing act between personal choice and the greater good. And right now, I just think that for those reasons, the board should consider a mask mandate. Thank you.
Can I add something to that?
Sure.
Okay. I understand what you're saying. It's not my fault that 35% of the population are not vaccinated, and you're punishing the same people again. You brought up Boston, so I did my homework too, and on 11/18, their infection rate was 0.96. They've doubled. Worcester was 1.24. They're now 2.78. They've more than doubled. And Fitchburg was 4.18. They're now 9.83. And the city of Lowell was 4.98. We're now 9.87. If masks work, why aren't the rates different? Thank you.
Right, so those numbers are absolutely correct. They're part of what I just mentioned. The city rate is 9.8.
Correct.
So masks are only a small portion of the strategy around.
Then find another reason, please. Don't take a small percentage and put a guy who is out of business for over a year to get it down by 0.1. Find another way.
Can I ask you a question?
Yes, sir.
What do you just talked about those numbers. Boston started out at 1%, we were 4, there are 2, or whatever it is now, we're 9. What do you think the difference between those populations is? Is it just the vaccine, or do you think maybe the mask mandate is the reason that they're less than half of what ours is?
Well, I think before the mask mandate, they started off, they've doubled since they've had a mask mandate, and
Right,
we've
but-
doubled too. I just think it's doubling. So I don't think the mask mandate in Boston has worked because their numbers have doubled. And yes, it's a different city, and yes, it has different people, but if the mask mandate worked, their number wouldn't have doubled. So it's doubling. Everywhere is doubling. If you, I looked at the
It's doubled, but it's still much lower.
But they
than
started
lower.
off lower than us.
Yeah, it's still,
They doubled. So it's the season and things have changed, but the masks haven't stopped it. They're still doubling. Right?
Right,
They're
right,
still doubling.
yeah.
The masks haven't worked. And everyone likes to say they do, but they don't. I'm sorry. But they don't make a significant difference to put
I hear you.
all these people's livelihoods in jeopardy.
So I hear you. So,
So,
A solution has to be found. The city got all that money from the government. I think the city's sitting on $6 million in surplus because of the,
right. So, sir, we wish we had,
$25, give $1,000.
we wish we had another measure that would work. You know, what are you suggesting that would be another measure that would
Well, I
stop
think
the spread
the city
of
got all that
infection of an airborne organism? I mean, what other, what is your suggestion?
Pay them $1,000 or don't let them come in. Do a vaccine mandate. I mean, it's not just about a mask and telling us we have to enforce everyone.
Yeah,
So New York City has a vaccine mandate. Does it work? I have no idea. But the answer isn't to tell us, hey, everyone's got to wear a mask.
I appreciate,
Bring it down, because it's not going to.
I appreciate what you're saying, and I agree with you. Nobody would like a mask mandate better than a vaccine mandate more than I would.
I agree, but, I mean, let's find something else, folks.
Okay,
Right? Because the mask thing doesn't work.
thank you.
Thank
So I just wanted to say, we only have the room till 6:30. Unfortunately, there are people waiting to get in, so
Yep.
and I'd like the board to be able to speak, so I'll just wrap it up here if you would.
Just one quick question. You said everything's scientific. Do you have scientific proof that masks work? Because you,
Let the scientists speak to that. I'll let the scientists speak to
okay.
that.
so there were studies done decades ago about using masks in surgery. And I would question you, would you ever want somebody operating on you without a mask? The answer is masks absolutely do work. What has not been done in
They work
study.
for COVID.
Yeah, so to my
I'm
point.
sorry, sir, could you let Dr. Galvin finish? Thank
So
you.
to my point, I have not seen any studies that have looked at masks with and without masks in COVID to see whether reduce it. But quite honestly, most doctors aren't really spending the time trying to do that. And it's very hard to actually do that for a lot of reasons, including making sure they're using it correctly. All the studies that you brought up, they were brought up, they were done recently, but they were done by a lot of people who are anti-mask and trying to show some reasons not to use it. None of these studies are compelling enough to say that we should stop using them, in my opinion, even though they're real, and there might be some of these. You're still better off with the mask than without a mask. There is no question, and you're not going to find a single MD who will tell you that wearing a mask doesn't cut down my expelling airborne virulence that can infect other people. It does. And if you don't believe me, if you don't believe that, then next time you have surgery, tell your doctor, I don't want you to wear a mask while you're operating on me.
Okay, I don't believe that it stops the COVID because the COVID is a 0.125 microns.
It's not stopping COVID. So
Yeah.
let me just, here's what I would say to all of you, right? Nothing stop, the only thing that's gonna, there's nothing that's gonna stop COVID, period.
So then
Okay.
why put in a mask?
Even the vaccine doesn't stop it. But can we slow it down? Can we make it less likely? So when this whole thing started in March of 2020, okay? And here I am going to touch my mask, just going back to how we don't use it right. The whole purpose of all the things that we did, including shutting down society and shutting down your businesses, was about not getting to a point where medicine was so overwhelmed that people were dying, not just because of COVID, but because they couldn't get the medicine that they needed. They couldn't get on a ventilator to keep them alive to get them through it. We knew we were going to lose some people. Some people were going to die of COVID no matter what we do, and some people will always be dying, just like the flu, of COVID no matter what we do. But what we don't want is we don't want people dying of COVID because we couldn't take care of them, okay? So, and by the way, I agree with everything you all said. There's only one thing I might disagree with, which is that all of you think your businesses got so much better when the mask mandate was released. I would argue it had nothing to do with the mask mandate being released. It had to do with the fact that we released the mandate when the numbers were down, people were not dying at the same rate, and people felt safer to come back out to your businesses again. It wasn't that they didn't have to wear a mask. It was because society, the rates went down and people felt safer going out again, okay? And I will argue that all the way. And I don't know, does anybody have any statistics about businesses, including small businesses in Boston, in Cambridge, where the mask mandate has been? I was in Boston this weekend. That place is going crazy. I was in a mall, you couldn't walk anywhere. Everybody had masks on, but it was bustling. So I'm not quite sure that it's that dramatic to your businesses, although I am respectful of it.
Well, I live in
The
Methuen.
reason,
I'd go to Salem.
I've been fighting this, any changes on this board, we talk about it every month. I've been fighting changes forever because I do believe a lot of what you said.
Okay.
But I'm telling you today, Lowell General Hospital, their 2 ICUs are full, and there are 2 other floors that are now converted back to ICUs, just like it was back in April and May of 2020. There was a day last week, the nearest ICU bed available to Lowell was in Virginia. Okay? So what I'm trying to tell all of you is the reason I'm here today in support of this is I don't think masks are going to cure anything, but anything we can do to slow it down. If I can prevent one person from coming to the hospital who needs a ventilator, needs to be in an ICU, and can't get one because we don't have the resources to give it to them, then I would take that action. I agree with you all. We need more vaccinated. We are trying desperately. I don't want to go into the details, but if you've heard of monoclonal antibodies, not available here, the state's bringing them here sometime, hopefully in the next few weeks. I don't know when. That'll be a big thing. We are doing everything we can to fight this virus and trying to cut down. Again, you're not going to stop it from spreading completely, but slow it down and make sure that we can prevent people from dying from it, which is ultimately what we all want, okay? So I am truly sensitive to what you're all saying, and the masks are not the cure, and I go crazy every time I'm in a restaurant for the same reasons you do. But I will say this, you're sitting at your table eating a meal. The only people you're truly exposing are at your own table, your own family. When you get up and walk around, you're walking around to all these other people you don't know and vice versa. So there is a lot of hypocrisy in the rules, a lot of it, and a lot of things that don't make sense. And I'm not going to sit here and defend it because I go crazy with it too. But every little thing that we can do that might cut things down and slow things down right now to save people in that hospital, to save maybe one of your family members who end up in that hospital, I would encourage us all to do it. And the minute somebody asked about what triggers it, our numbers in September were in the teens. In October, they were in the 20s. And they stayed between 15 and 25 until November. And then now, since Thanksgiving, they're in the 60s. The last week, they've been in the 60s. So the numbers are crazy. And to somebody's point about the vaccine, and I will just give you this quick thing. 2/3 of the people in the hospital right now at Lowell General are unvaccinated, 1/3 were. But of the 1/3 that were, the majority of them are there for other reasons. They're having a baby, and oh, by the way, you're COVID positive, you're not sick. In the ICU, 85–90% of them are unvaccinated. So if anybody tells you the vaccine doesn't work, it does work. And so this entire town needs to start pushing this vaccine and get people vaccinated, because that's what will truly make the difference. And I promise you, if you get that number under 40, like someone wants a number from me, and we're all different, and even the hospital would have a different number, get back to that 40. We weren't coming here at 40 and saying we need to put the mask back on, but at 60 and no ICU beds, we do. We really do. We don't have anything else we can do. Separate 6 feet, wear your masks, and I know everybody's got COVID fatigue, but I'm telling you what's happening right now in the hospital is very scary. I'll stop there. I'm happy to answer questions and talk more, but I'll stop there.
You know, as far as hospital beds, you know, we're not only servicing people with COVID, people are having trouble getting surgeries because there's not enough staff and enough beds. People are having major life events that, you know, the access for care is definitely challenged when more people are sick and to the degree that COVID makes them. And so I agree with Dr. Galvin that we all have such a huge degree of COVID fatigue and our own struggles about masking and some of the conflicts about that. But it is a small thing we can do to try to tweak the numbers and curve the numbers back towards a more safe and sustainable access point for people in the entire community. And I think it's hard to compare Lowell to other communities that have a much higher vaccination rate than we do. And that's it. I just don't want to belabor anything. I as well have really a great deal of sympathy for people struggling to keep their businesses open. I know how hard that can be, and you know, it's not taken lightly. It's not a decision that's being taken lightly.
who's on speakerphone. Erin?
But I would just say, I echo Dr. Galvin, just that in knowing this board, we weren't at this point. I know that you review the numbers every single week. So if it does come to the mask mandate, it will be reviewed. I trust that this board will review this regularly. But I think that our vaccine rate and our COVID numbers are just not lining up. So we have to take the next.
Thank you. And Lisa Golden, who's the, Lisa Golden, the current health director for the city of Lowell.
So I just wanted to say one thing. So this morning when I went to my desk early this morning, I just wanted to let you guys know that the number of COVID cases over the weekend in the city of Lowell was 268. So this morning there were 268 new people over the weekend diagnosed with COVID. So those people were tested over the weekend, and who knows where they happen to have gone over the weekend, and then you think of like the last week where they happen to have gone, and those are the people that we're trying to slow down the spread. And I have to let you know, I am sympathetic. My office is in the downtown. I give you guys business, and I want to let you know that I have two 20-ish-year-olds who are fully vaccinated who will be frequenting your businesses over the holidays. So you will have some business.
I would just make one further comment. I came in here figuring this was just a quick visit. You have all made me rethink it. I'm still thinking about it. I promise you that I almost feel like I'm compelled to vote still for this thing, but you're making me second guess the decision, and I will promise you if it does happen, I'll be the first one to yank it the minute we can.
Right, so I just wanted to mention there'll be another Board of Health meeting the first week in January, and we'll also be discussing numbers. As of now, the mandate stands until the first week in February when we have the following meeting. And we're all hoping that things improve, that more people get vaccinated, and there's ICU beds available at Lowell General. But we, as Lisa said, we don't do this lightly. Nothing that we've done at the Health Department and the Board of Health, decisions that we've made have been done lightly, I don't think. And so that's all from the board.
Can I make one quick comment?
Sure.
So I just had seen, I'm not sure why to somebody's point, I'm not sure why the fitness centers are excluded from this. Again, it goes back to the hypocrisy and the confusion around it, like, different things for different people. I'm not sure why that would be different.
So Christine, so to the city solicitor, the question is, why is it that fitness centers are able to not wear masks if they maintain 6 feet distance between the individuals while they're there?
So this was drawn up for for tonight's meeting and for deliberation before the Board of Health. The Board of Health, by vote of the Board of Health, the board could make any change to the regulation that it sees fit. There are a number of communities throughout the Commonwealth that have adopted regulations similar to these, and what we tried to do in drawing up these regulations was to keep in the same spirit of what other communities were doing. And but again, we're in a different position, obviously, than most other communities. Aside from being the fourth largest in the Commonwealth, we also have the highest positivity rates as well, or just about. So any steps that any changes that the board wishes to make before you vote on its adoption or not, it would be up to the board.
Thank you. I do think that that probably other communities that have this fitness waiver in terms of if you're able to maintain 6 feet distance was just giving some consideration of the fact that people are working out, and it's a little bit more difficult to have a mask on when you're working out. And so if you're able to maintain 6 feet, They have allowed that in other communities, but if Dr. Galvin or anyone else wishes to make an amendment to the regulation, we can certainly do that.
I mean, my personal opinion on this is that it should be the same for everything. So it's either we allow everybody to separate by 6 feet and not wear them, or we make everybody wear them. I just assume they wear them. They did in the past. We had them, and you had to work out with your mask on. I don't know why we'd make an exception. Just to be consistent.
Okay. Motion passes 4-0. Thank you.
So that's on the whole thing?
Do we have a motion to adjourn?
Right, that's what, the entire thing. That was
Okay,
just the one.
okay, all right. I thought we were voting on the amendment with the, on the motion with the amendment. Okay. Okay. So do we have a roll call on the regulation as a whole? Right, do we have a motion on the whole the regulation as a whole?
Yes.
Second by Kathleen. Roll call, Joanne? Yes. Dr. Galvin?
Yes.
Kathleen? Yes. Erin?
Yes.
Motion passes, regulation passes 4-0.
I would encourage all of you to come to the January meeting with whatever statistics you have about your businesses. We are more than willing to listen to it and change our minds then.
Do we have a motion to adjourn?
Motion to adjourn.
Second. Thank you.